Welcome to this deep dive. Today we're tackling a question that sounds simple on the surface, but really isn't. What's the actual recovery rate for alcoholism? Or, the more formal term, alcohol use disorder, AUD.
It really does sound like there should be just one number, doesn't it?
Exactly. But when you start looking at the sources, and we've got a lot here, research papers, reports from NIA, SAMHSA, CDC, it becomes clear pretty quickly that it's complicated.
It absolutely is. The way recovery is defined, how it's measured, personal experiences, societal views, it all layers in.
So our mission today is to unpack all that material, pull out the key insights, and give you a clear understanding of what recovery from AUD actually looks like and, what the numbers really tell us about how often it happens.
Right. It's about getting beyond a single percentage to the reality underneath.
Okay, let's dive in.
So maybe starting with the basics from the courses. What exactly is alcohol use disorder?
Good place to start.
Well, it's formally recognized now as a chronic relapsing brain disorder. The key thing, according to sources like NIAAA, is that impaired ability to stop or control drinking, even when it's causing real problems socially, at work, with health.
And it's diagnosed with specific criteria?
Yes, the DSM-5 criteria. There are 11 of them, and if someone meets 2 or more within a 12-month period, that leads to a diagnosis.
And a really important point that sources make is that it's not just yes or no anymore, right? It's more nuanced.
Exactly. It's understood as a spectrum: mild, moderate, severe, depending on how many criteria are met. And thinking about it as a spectrum it's crucial for figuring out the right approach to treatment and recovery.
Which is a change from the older way of thinking, the sort of alcohol abuse versus alcohol dependence categories.
A really significant change. The sources suggest moving to this single AUD spectrum helps identify problems earlier, maybe even in milder cases. And it helps chip away at that old, unhelpful stigma of just being an alcoholic or not. It frames it more like other health conditions.
Okay, so that's the disorder. What about recovery? Because the sources are very clear. It's way more than just, stopping drinking.
Oh, absolutely. The whole definition of recovery has been evolving. It's seen much more now as this dynamic, very individual process.
How so?
Well, NIAAA, for instance, defines it as being in remission from the AUD criteria. And interestingly, they specifically say except for craving, plus stopping heavy drinking, and also seeing improvements in well-being, social connections, daily life functioning.
And Sam Agesta takes an even broader view, I noticed.
Yes, Sam Agesta talks about it as a process of change to improve health and wellness, live a self-directed life, and reach your full potential. They talk about 4 key dimensions: health, home, purpose, and community.
And this is where it gets really interesting, challenging that old idea that recovery just equals abstinence. This broader view changes everything about how you'd measure success.
It's a genuine paradigm shift, moving away from just looking at the absence of the substance toward looking at the whole person, their mental and physical health, their growth, how they're functioning day to day.
Right, because historical models, maybe influenced by groups like AA, really focused almost exclusively on abstinence.
They did, and that's been hugely important for many people. But these contemporary definitions from major health bodies are clearly saying, okay, abstinence is one path, but recovery also involves these other vital areas of life.
Because, someone could technically be abstinent but still feel miserable, isolated, or lack purpose. Just not drinking doesn't automatically equal a fulfilling life.
Precisely.
Yeah.
And the sources emphasize recovery is a process, not some static endpoint you just arrive at. It's ongoing, it changes, and it can involve ups and downs, even setbacks like relapse. So recovery rates are really just snapshots within that journey.
That makes sense. So given all that complexity, how do researchers actually try to measure this? What are the benchmarks?
They have to use more specific definitions for research, often focusing on remission and cessation from heavy drinking. Remission, again, means not meeting AUD criteria for a set time, but importantly, still potentially experiencing cravings.
And cessation from heavy drinking has actual numbers tied to it.
Yes, for research purposes. NIAA often uses limits like no more than 14 drinks a week or 4 in a day for men, and no more than 7 a week or 3 a day for women. These are research guidelines, not necessarily clinical advice for everyone.
And they track this over time using different categories.
Right. You see terms like initial remission, early remission, like 3 to 12 months, sustained remission, maybe 1 to 5 years, stable remission over 5 years. The DSM-5 has similar categories for early and sustained.
That explicit exclusion of craving from the definition of remission is fascinating. Why is that so significant? Craving seems so central to the experience.
It is central, and it's a predictor of relapse. But excluding it from the definition of remission acknowledges that managing cravings might be a very long-term, even lifelong, part of managing the condition, like managing symptoms in diabetes. Its presence doesn't automatically mean someone isn't functionally recovered or in remission by these standards.
Okay, that makes sense. Now, another thing the sources really dig into is this debate, abstinence versus non-abstinent goals.
Yeah, that's a big one. Historically, abstinence was often framed as the only acceptable outcome, especially in traditional settings.
But that's changing.
Definitely. There's growing recognition, backed by research, that for some people, maybe those with milder AUD, or as an intermediate step, reducing drinking to non-heavy levels or controlled drinking, can be a valid recovery pathway. NIA's own research definition, including cessation from heavy drinking, reflects this.
Is there data showing people achieve recovery without total abstinence?
Yes, there is. For example, one large national study, NASARC-3 data analysis, found that among people who previously had AUD, pretty similar numbers achieved recovery through non-abstinent pathways compared to abstinent pathways. About 17.9% versus 16.0% in that particular study.
So that naturally leads to the question, is one goal better?
The sources seem to frame it less as better universally, and more about what's pragmatic, what reduces harm, and what works for the individual. Insisting on abstinence only can actually stop some people from seeking any help at all. And the research does suggest that people who manage to sustain non-heavy drinking levels can often achieve similar improvements in their quality of life and functioning compared to those who become abstinent. Different paths can lead to good outcomes.
And this whole debate ties directly into stigma, doesn't it? The idea of who can or can't drink moderately.
Absolutely. The traditional view often held that anyone with a serious alcohol problem could never safely drink again. Embracing non-abstinence goals or appropriate challenges that really rigid viewpoint, it suggests meaningful improvement is possible in different ways, offers more options, and potentially reduces stigma by showing recovery isn't just one thing. But it definitely makes measuring success more complicated than just counting who's drinking and who isn't.
Okay, so recovery involves drinking patterns, diagnostic criteria, and these broader life aspects. Let's talk more about that quality of life piece.
Yeah, that's becoming increasingly central. Successful recovery isn't just about the absence of problems, it's about the presence of well-being. Improvements in quality of life, QL social functioning, mental and physical health, finding purpose. Samach's dimensions really nail this: health, home, purpose, community.
And is there a clear link in the research between drinking and QL?
A very strong link.
Yeah.
Heavy drinking consistently drags down quality of life. And conversely, stopping or significantly reducing drinking is linked to substantial improvements in QL.
Does it matter if someone is abstinent versus just reducing?
Some evidence suggests that maybe abstainers have slightly more stable long-term recovery or slightly better QL in some areas down the line. But the main point is that improving QL and functioning is a core part of recovery, regardless of the exact drinking pattern, as long as the harmful heavy drinking stops.
Because, like you said, being abstinent but still feeling terrible isn't really full recovery from the person's perspective.
Exactly. Measuring these broader aspects gives a much more complete, patient-centered picture. It shifts focus to positive growth, which can be really motivating too.
All right, let's get into some of the numbers the sources offer. First, just how common is AUD? And then how many people are actually trying to make a change?
Okay, prevalence first. The 2023 National Survey on Drug Use and Health, NSDUH, estimated about 28.9 million people aged 12 or older had AUD in the past year in the U.S. That's roughly 10.2% of that age group. For adults 18 plus, it was 28.1 million, almost 11%. It's a major public health issue.
Millions of people. And out of those, how many are trying to change things?
The sources suggest it's maybe only about a third of people with AUD who actually try to change their drinking in any given year. So when we talk about recovery rates, we're often looking at that specific subgroup.
And then there's that huge treatment gap you mentioned earlier.
A massive gap. That same 2023 survey found only 7.9% of people with past year AUD got any kind of alcohol treatment. And for medication-assisted treatment, MAD, which is highly effective, just 1.9%.
Wow. Why so low?
Barriers like not feeling ready, cost, Insurance issues, stigma, or just not knowing where to turn for help are commonly cited.
That gap is critical because it means stats based just on treatment populations miss a huge part of the picture, right? Like people recovering on their own.
Exactly. What's often called natural recovery, people improving without formal treatment, is actually quite common. Some research suggests around 70% of people with alcohol problems experience significant improvement this way over their lifetime.
70%, that's surprising.
It is. But despite the treatment gap and measurement challenges, the overall data does offer a lot of hope. Sources like a CDC Any Day study suggest about 3 out of 4 people, 75%, who experience addiction eventually recover.
That's a really powerful counter-narrative to the idea that addiction is hopeless.
It really is. And self-reported data from SAMHS backs this up. Over 72% of adults who felt they had a substance use problem consider themselves to be in recovery. The latest NSDUH had that figure around 73.1%. Now, these are self-reports reflecting a personal sense of progress, but they show recovery as a very common outcome.
So, recovery is achievable and common. But does getting formal help actually boost the odds compared to that natural recovery path?
The data strongly indicates yes. People who get professional help for AUD tend to have significantly higher rates of sustained remission. One source mentioned figures like 62.4% achieving 3-year remission with help versus 43.4% without. They also seem less likely to relapse over the long haul.
So those low treatment rates really represent a missed opportunity. More access could mean even better overall recovery outcomes in the population.
Absolutely. Improving access to evidence-based care is key.
Now, even with help, the sources are very clear. The path is rarely smooth. Relapse often comes up.
Yes, and it's so important how we frame this. The sources emphasize relapse isn't a sign of failure or weak character. It's described as a common characteristic of chronic illnesses, similar to symptoms recurring in diabetes or hypertension. Thinking about it that way can reduce so much shame and stigma.
And the numbers reflect how common it is.
They do. General relapse rates for substance use disorders are often cited in the 40–60% range. For alcohol specifically, some sources say over 70% of people treated for alcohol abuse might experience a relapse at some point. Framing it medically encourages people to learn from it and get back on track, not just give up.
Okay, these numbers can sound a bit scary, high prevalence, common relapse. But you mentioned something really interesting earlier, how the risk changes over time.
This is probably one of the most hopeful pieces of data in all the sources. That first year of recovery is definitely the toughest, the most vulnerable period.
How tough?
Well, sources suggest maybe 2/3 relapse within the first 6 months. Over 75% might relapse within that first year. Somewhere between 40% and 80% might have at least one drink in the first year after stopping, and maybe 20% return to heavy drinking levels. It highlights why that early support is so vital.
But it gets better after that.
Significantly better.
Our risk
Drops off sharply. In the second year, the relapse rate is down to around 21.4%. Then, in years 3 through 5, it falls again to about 9.6%.
Wow. And the really long term. After 5 years.
That's the milestone. After 5 years of sustained recovery, the relapse rate drops to around 7.2%. And critically, other analyses suggest that once someone reaches 5 years of continuous sobriety, their chance of relapsing ever again falls below 15%.
Less than 15% after 5 years. That's incredible. It really shows that while the start is hard, sticking with it builds real resilience. Time is a huge factor.
It absolutely is.
Okay.
It suggests recovery capital builds up, coping skills get stronger, support networks solidify, the brain continues to heal. The longer someone sustains recovery, the more probable continued recovery becomes.
And it's not just whether people relapse, but the pattern of their recovery journey that matters, right? Some studies looked at that.
Yes, big longitudinal studies like Project Match and Combine tracked people over years, looking not just at yes/no relapse, but the transitions between heavy drinking, non-heavy drinking, and abstinence. They found different patterns.
What do those patterns show?
Well, obviously, people who stayed in remission continuously did best. But importantly, people whose patterns showed they transitioned into remission, even if they started heavily or had setbacks or patterns where they relapsed but then returned to remission, those groups had much better long-term outcomes than people who stayed in continuous relapse.
So that really backs up the idea that a relapse isn't the end of the story. Being able to get back on track is actually a key part of successful long-term recovery for many.
Exactly. It counters that all or nothing, one strike, you're out thinking. The data shows bouncing back is common and leads to good outcomes.
Okay, so knowing all this, the definitions, the measurements, the patterns, the role of time, What factors do the sources say actually influence whether someone achieves and sustains recovery? It sounds like a mix of things.
A real mix. The research points to a combination of treatment factors, individual factors, and social environmental factors all playing a role.
Let's break those down, starting with treatment interventions.
We know seeking professional help improves outcomes. But beyond just getting help, things like the type of help matter. Evidence-based approaches like behavioral therapy, CBT, MIT-E, and medication-assisted treatment, MNT, with drugs like naltrexone or acamprosate are highlighted.
And MNT is the one that's really underused.
Shockingly underused given the evidence. That 1.9% figure is concerning. Barriers like lack of trained providers, access issues, cost, and unfortunately persistent stigma against using medication for addiction are major problems.
And how long someone stays in treatment matters too.
Absolutely. Duration and intensity count. NID suggests around 3 months is often needed for significant improvement, and longer residential stays like 90 days plus seem linked to better outcomes. And crucially, ongoing aftercare and support after the main treatment phase ends is vital for long-term success. It's not a one-and-done thing.
Okay, what about individual factors? Does how severe the AUD was initially make a big difference?
Severity impacts the type and intensity of care needed, for sure. Someone with severe AUD likely needs detox and more intensive support initially. But the sources stress that recovery is possible regardless of severity if the treatment is appropriate. It might just be a longer or more complex road for some.
And co-occurring mental health conditions, we touched on how common they are.
Huge factor. At 20.4 million adults with both SUD and mental health issues. It's critical. Integrated treatment, addressing both simultaneously, is essential. Treating just the AUD often isn't enough. Physical health issues also need attention.
Are there psychological aspects like personality or motivation?
Yes, definitely. Things like motivation to change, coping skills, self-efficacy, that belief in your own ability to succeed, hopefulness, they all play a role. Therapies often target these. And there are biological factors too. Brain changes related to addiction, stress responses, craving intensity that can influence risk, and are targets for some treatments.
And finally, the social and environmental piece. How important is that?
Immensely important. Social support comes up again and again in the sources as critical. Support from family, friends, peers, recovery groups, it provides a buffer against stress, reinforces positive behaviors, and creates a pro-recovery environment. Samet Jace's community dimension highlights this. Lack of support or being in a negative environment. Big risk factor.
And stigma fits in here too as a negative environmental factor.
A huge one. Stigma prevents help seeking. It undermines engagement in treatment. It leads to secrecy and shame around struggles or relapse. It can even affect how healthcare providers interact with patients. And as we discussed, it likely messes with the accuracy of the data we have.
What about things like jobs and housing?
Also key parts of what's called recovery capital. Stability in housing, employment, education, these provide a foundation. Meaningful employment, in particular, seems linked to better long-term outcomes, providing structure, purpose, and integration.
Okay, so pulling all this together, the definitions are slippery, the measurement is hard, the journeys are individual, and all these factors are interacting. It really becomes crystal clear why you can't just slap one percentage on alcoholism recovery.
Exactly. It's just not meaningful to try and find one single number.
The definitions vary too much.
Right. Abstinence, non-heavy drinking, quality of life.
Yeah.
Studies measure different things. Apples and oranges.
The research methods have limits.
Self-reports, people dropping out of studies, samples that aren't representative, different follow-up times. It all muddies the waters.
Stigma messes with the data.
People hide problems, maybe don't report accurately. We likely underestimate the true prevalence and maybe skew recovery reporting.
And ultimately, recovery is just too personal and nonlinear for one number.
It's a human process full of twists and turns. A single rate just can't capture that reality.
So given all that complexity, what does it mean for actually improving things? What do the sources suggest works?
It means effective strategies have to be comprehensive. We need treatment that's easy to access, tailored to the individual, and integrated addressing substance use and mental health together. It needs to last long enough with strong aftercare. We desperately need to boost MAT use by tackling those barriers. Building social support and recovery capital is essential. Addressing psychological factors, and always working to reduce stigma.
Based on the sources, what are the takeaways for different people listening, maybe for someone seeking recovery themselves?
For you, if you're on this path, please hold on to hope. Recovery is achievable, the long-term odds get really good. Be persistent, setbacks can happen in any chronic condition. Learn from them, don't let them define you. Seek help, professional support, and peer groups really do increase your chances. Build that positive support network. Develop coping skills. And view relapse, if it happens, as a signal to adjust your plan, not as a final failure.
What about for doctors or therapists?
The advice is, do thorough assessments. Look at severity, co-occurring issues, social situation. Individualize the plan. Really consider the person's goals, which might include moderation for some. Provide integrated care. Educate yourself and your patients about MAT. Advocate for its use. Emphasize long-term support from day one. And always use person-first, non-stigmatizing language. It matters.
And for policymakers.
The big things are increase access to evidence-based treatment, reduce those cost, location, and system barriers, fund integrated care models, support recovery-oriented systems, things like housing, peer support, launch serious anti-stigma campaigns, and fund more research, which leads to what kind of research is still needed.
A big push for standardizing how we define and measure recovery. We need consistent, multidimensional outcomes beyond just drinking, looking at QLO, function, well-being. We need more high-quality, long-term studies following diverse groups of people over many years.
And research into how these treatments actually work, the mechanisms of change, so we can make them even better and more personalized. We just need better tools and more consistency to get more accurate data.
So when you hear that question, what's the alcoholism recovery rate? You now have a sense of why there's no simple answer.
Recovery from AUD is, well, it's complex, it's personal, it's often not a straight line. And it really means so much more than just putting down the drink. It's about rebuilding a whole life, health, purpose, connection.
And while that journey is definitely tough, especially at the start with those higher relapse risks, the overall picture from the data is actually quite hopeful. Recovery is a common outcome for addiction, and the chances of staying recovered get dramatically better over time, especially after that 1-year mark, and incredibly strong after 5 years.
Seeking help clearly improves the odds, but those significant barriers, stigma, cost, access, are still stopping far too many people from getting the support that could make all the difference.
Understanding all these facets, the complexity of recovery, the factors that influence it, the measurement challenges, gives us a much richer, more accurate, and ultimately, I think, more hopeful perspective than any single statistic ever could.
And it leaves us with a question to think about. If recovery is this ongoing process of growth, managing a chronic condition, and building a meaningful life, how can we, as a society, do better at supporting people wherever they are on that journey, acknowledging all the different paths and understanding that setbacks aren't failures, but part of the process for many?
Thanks for joining us for this deep dive.